So, testosterone has been billed as the great anti-aging medical intervention. And there's all this on TV, you see low T clinics, androgel, improve your sex life. It's moved on. It was Viagra ads, now it's testosterone ads. There's a lot of hype about testosterone, but the question is it useful and is it safe? Those are the big things. Are there pros, are there cons? That's the major question. So first let's go back. In men, testosterone declines by age. You start off in your 20s, 100%, vim and vigor, we start off. We'll come to women in a moment, we'll talk about hormones as well. And it goes down by every 5 years, it's dropping by about 20% until the average man of, I'm 53, 50 say, is now at 55 to 60% of their testosterone that they had when they were 25. How can that be a good thing? Well, in the days when life expectancy was 45, which is 150 years ago, not that long, men and women died in their 40s and 50s. When you stopped having babies and you stopped being able to fight with the leopards or the warring factions, you died. That was it. Occasionally, old men lived till 60, 70, maybe even 100. So now we're living to our 80s, but we're outstripping our hormone supply. So the question is, can we replace it? Yes, we can. Does it have benefit? Well, look at where testosterone works on men. Testosterone works on more than just the brain and the penis. Of course, it's important. It works on almost every organ: skin, liver, sexual, kidneys, bone marrow, bone. It works everywhere. The same as estrogen and progesterone work in women on every organ. By the way, women also have testosterone, and it works on all the organs as well. It does affect every organ, and you need it in every single organ. So when a man is lacking in testosterone and they get testosterone replaced up to normal levels, I stress normal, they will have better brain function, not be as aggressive, they mellow out when they're given testosterone. Actually, grumpy old men lack testosterone. Their kidneys work better, they get more erythropoietin, which gets their bone marrow to make more red cells and they're less anemic. That's why Lance Armstrong was taking testosterone. So you could get more strength and more red blood cells, thicker blood, and climb the hills of the Tour de France better. And that's why it's immune. So, if it's so good, why isn't everybody on it? Well, there are a lot of side effects spoken about. The big one that's been in the news, and the FDA came out with a warning recently, in June, was that there was a heart attack risk from testosterone. No surprise. Well, here's the key. Men with low testosterone, too low testosterone, they get round, squeaky voice, they get quicker heart attacks. So lack of testosterone definitely is associated with more heart attacks. Now, why did they show in one study 56,000 men that the men who took testosterone in the first 3 months there was a higher rate of heart attacks? Well, do we have an answer?
Because when you go from really low to really high, it's not too much of a jump in spectrum.
Could be the issue, yes, that too low testosterone is a problem, too high testosterone is a problem, but in the middle is right. So why then are any men bothering to take testosterone? Because we don't know. These men were just taking regular testosterone. So some people say, well, it's because they were the ones that had more heart attacks were over 65 and already had heart disease, and the testosterone just pushed them over the edge. Well, just to muddy the waters, somebody else did a study, University of Texas, published this year in May. And that one's of 25,000 men, big studies, and it showed that the men who took testosterone had lower rates of heart attack than the men who didn't. So bottom line is, we don't really know, because both of these studies were actually useless. They didn't actually take 100 men, 55,000 men, put them on testosterone and say, let's watch them. They went back to the records and they looked back in the old records and saw who had testosterone, who had a heart attack, and then they pieced the stats together. That's called a retrospective study. The best studies are prospective, where you go forward and you put people on it and then you watch them for 10 years and you see what happens. That's not what's done here. Is that kind of study going to be done? Probably not. So the bottom line is, you've got to watch men over 65, be more careful, and men with coronary artery disease already. And Nancy is probably correct. Most physicians feel that too little hormones is bad for you, too much hormones is bad for you. We want to be like Goldilocks' third bear, just right. So that's exactly where you want to be. And the men that abuse testosterone, you know, the manorexics that take their steroids and they bulk up and they've got the test. No, they're just huge and they're abusing the testosterone and the other hormones, and they're looking, and they are doing damage to themselves. So if you have a partner or a boyfriend or a friend or a brother that is abusing steroids at 20 or 30, and testosterone included, they are setting themselves up for problems.